I am not a medical professional, so do not take this as medical advice. Hey everyone, today I'm filming a video on what PANS and PANDAS are. So I'm making this video because I asked on my Instagram page a little while ago if anybody had any ideas of videos I should film, and someone said that they wanted a video which was a basic overview of what PANS and PANDAS are because they just want to learn more. So that's what I'm doing today. PANS and PANDAS are conditions which can cause various neurological, psychiatric and sometimes physical symptoms, and they are thought to affect 1 in 200 people. PANS and PANDAS are not psychiatric conditions, however, even though they can cause psychiatric symptoms. PANDAS is triggered by a streptococcal infection, and PANS is triggered by both infectious and non-infectious agents. The infectious ones can include Lyme disease, Mycoplasma pneumoniae, the flu and other things, and non-infectious triggers can include stress and metabolic issues and other things. For the cases that are triggered by infections, PANS and PANDAS are predominantly neuroinflammatory / neuroimmune conditions. Therefore, even though people with PANS PANDAS can have very serious neurological and psychiatric symptoms, it's not really the brain that's the problem, it's the immune system that's the problem, and because the brain of someone with PANS PANDAS is usually originally fine, but then the immune system gets confused and goes to attack the brain, and then and then neurological and psychiatric problems start developing. So the main symptoms of PANS and PANDAS are OCD, tics and eating problems, and to be diagnosed people do need usually at least one of those symptoms. Now the diagnostic criteria for PANS and PANDAS is slightly different. For PANDAS you need OCD and or tics, and for PANS it's OCD and or food restriction plus symptoms from at least 2 other categories. So it is slightly different, but the conditions can look very, very, very similar. Other symptoms that people may experience include a loss of coordination, a loss of sensation, personality changes, rage attacks, oppositional defiance, sensory processing issues, sleep problems, urinary problems where people experience enuresis and may need to go to the toilet more than usual. Separation anxiety is quite a big thing, mood swings, emotional lability, depression, seizures in some cases, people have those, psychosis, some people have hallucinations, and some people also have delusions, but I think that's rarer, it's usually hallucinations that people have. Dilated / enlarged pupils can also be a symptom. Fatigue and joint problems. Some people have joint pain / joint aches when they're in a flare as well. Autistic-like traits. Some people have developmental and behavioural regression where people may act younger than their age or go back on developmental milestones, and lots of different things. Other symptoms which I forgot to mention but I think are important to include handwriting deterioration, math deterioration, low muscle tone, dizziness and balance problems, and brain fog. Some people may only have a few symptoms, whilst other people may have many, many, many symptoms. Usually OCD, tics or food restriction must be present. Symptoms can change over time because people with PANS PANDAS often have flares, and a flare can be where a person gets an infection and quite suddenly sometimes develops a ton of different neurological and psychiatric symptoms, and it can be absolutely debilitating. But then after maybe a few days, a few weeks, a few years or a few decades, the flare may subside a little bit. But like I just said there, flares can last different periods of time. But yes, so as I said, the symptoms can change in each flare. So when someone's a child, they may have a flare where they have OCD, sensory processing issues and separation anxiety, but then when they're a teenager they may have a flare where they develop hallucinations, tics and problems eating, for example. Please note that not everyone has flares. PANS PANDAS can be chronic static, meaning that symptoms are always there unless they are treated, and they're always bad. This can be relentless. PANS PANDAS can be chronic progressive, meaning that the symptoms just get worse and worse over time unless someone is treated. The symptoms can pile on top of each other and someone's symptom list may just grow. Although the onset of PANS and PANDAS does usually occur in childhood, people can have it in adulthood. The onset of PANS can occur at any age, so people can develop it for the first time when they're an adult, but as well as this, people don't really grow out of PANS PANDAS. It's possible that people who do not get the right treatment or the right amount of treatment can have symptoms which persist into adulthood, or if people as an adult get an infection, they can go into another flare then as well. PANS and PANDAS can have a genetic predisposition. I did see something about a gene has been found that's associated with the conditions, and this is why it can sometimes run in families. It can be inherited, and there's often multiple people in a family who are affected by PANS or PANDAS. Whereas conditions like autism and ADHD are often noticeable when a person is very young. People with PANDAS can be typically developing, but then at the age of 10, for example, they may develop many neurological and psychiatric symptoms and may appear to deteriorate. People with PANS/PANDAS report not responding well to psychotropic medications such as antidepressants and antipsychotics, although some people do respond well to them, but that's a small percentage. For most people, they need things like antibiotics, IVIG, which is intravenous immunoglobulin, plasmapheresis, and things like that target the immune system and triggering infection. Trigger warning, there is a mention of triggering topics coming up, so skip to 6 minutes 55 seconds to miss that. Unfortunately, there are a lot of doctors who do not fully understand PANS and PANDAS and who may not be able to distinguish it from more common neurological and psychiatric conditions. But this is really harmful because if people are not given the right care, then they may not be able to really recover. Because after a flare, some people do get better after a flare, some people don't. As I said, some flares can last like decades or years, and it can be really, really horrible for people. So the right care is really important because unfortunately some people with PANS/PANDAS do experience suicidal ideation, and that can of course be really dangerous. If somebody isn't getting the care they need and they are stuck in that state, it can end very badly. So it's vital that people get the care that they need, and yet again, people do not always respond to the psychotropic treatments usually given, so it's important to treat it as it's meant to be treated and target the immune system, inflammation and infection. PANS and PANDAS affects everyone differently. So one person with PANS/PANDAS, their main symptoms may be psychosis and OCD. For another person, it may be tics and rage attacks and coordination problems. For another person, it could be an eating disorder and autistic traits. It can be different for everyone. And again, that's why it can be difficult to diagnose in some cases. But I think the features that you look out for are atypical symptoms that don't really occur in other conditions like autism or Tourette's or non-PANS/PANDAS related OCD, like the urinary problems and things like that, or a really sudden onset. People with PANS/PANDAS, as I said, usually have a really sudden onset, although not always. But the sudden onset can look like someone who goes to bed fine one day and then wakes up the next day with a personality change and they are completely consumed by OCD, possibly psychosis and things like that. It can be terrifying for people, but in some cases it is a little bit more gradual, and people may develop more and more symptoms until one day it does just explode and you can tell, yeah, that's PANDAS/PANS, it looks like PANDAS/PANDAS. It's thought that around 70% of people with PANS/PANDAS have tics, and this can include both motor and vocal tics. Some people just have motor tics, some people may just have vocal tics, and some people, like myself, have both. Unfortunately, it can be really difficult for some people with PANS/PANDAS to get the treatment that they need, because in the UK there aren't really strong treatment guidelines that help people with PANS/PANDAS, and in places like America, insurance companies often don't cover the PANS/PANDAS treatment like IVIG, and that can be really horrible for people because sometimes it can seem virtually impossible to get the needed care, even though it's so important that someone gets the right care. Fortunately, some people find that it can take them years or decades to get the correct diagnosis of PANS/PANDAS because not a lot of doctors are really understanding of the conditions, and if you go to your regular doctor, they may have never heard of it, or they may not know how to diagnose or treat it, and they may not know where to refer you to. PANS and PANDAS isn't necessarily something you can get better from straight away. As I said, you have relapses if you get another infection, but with the treatment, some people do respond immediately or quite quickly to antibiotics, and that can be amazing, but in some cases people need many rounds of IVIG, or they need plasmapheresis, which is a really strong treatment, in order to have a better quality of life. So healing can take quite a bit of time, sometimes years, so it isn't a overnight thing that you can fix. Conditions which people with PANS, PANDAS, BGE may be misdiagnosed as having include Tourette Syndrome, an anxiety disorder, ADHD, bipolar disorder, possibly emotionally unstable personality disorder, or non-PANS, PANDAS related OCD. People may also be misdiagnosed as having non-PANS, PANDAS related depression, oppositional defiant disorder, or schizophrenia. Other conditions which people can be misdiagnosed as having include behavioural problems, sensory processing disorder, functional neurological disorder, or autism. PANS, PANDAS, BGE can mimic and resemble other conditions. It is a great impersonator. It's important to note, though, that PANS and PANDAS are distinct conditions in themselves. Even after a flare, when the worst symptoms are gone and when people aren't completely consumed or debilitated by their condition, people can have residual symptoms. So people may have issues with like hyperactivity left over, they may have some minor OCD traits left over, may have some tics, they may have some memory problems, just things like that, which aren't as bad as they were in the worst of the flare, but they're still there to an extent, and that can be something that people do have to kind of adapt to as they're healing, or in general, because sometimes the residual symptoms don't go away. People just have to kind of adapt to those things, but it is worthwhile 100% to get the right care because things can improve dramatically. PANS, PANDAS is lifelong in the sense that if someone gets an infection at any point in their life, they can go into a flare. So there are adults with the conditions. However, I need to say that the conditions are treatable. So even if someone has debilitating neurological and psychiatric symptoms, they can get treatment, and for years or even decades potentially, if they don't get the same infection, they could be symptom free or they could have dramatically reduced symptoms. So the conditions are treatable, but they're not fully curable because it is possible for the symptoms to come back if someone is exposed to a trigger. Important for me to note that the streptococcal infection, which can trigger PANDAS, doesn't have to be strep throat. It could be scarlet fever, it could be perianal strep, intranasal strep, penile strep. Strep can be in different places of the body, so it isn't always in the throat. You'd be wondering, how does an infection trigger neurological and psychiatric symptoms? It can trigger neurological and psychiatric symptoms because the immune system gets confused, and instead of just attacking the bacteria, let's say in this example it's in the throat, instead of just attacking the bacteria, the immune system also goes to attack part of the brain called the basal ganglia, which is right in the middle of the brain. And that's part of the brain that's been associated with Tourette's and OCD, which is why the symptoms of PANS, PANDAS can sometimes resemble those conditions. But yeah, the immune system goes to attack that part of the brain, it becomes inflamed, and people develop many different symptoms. PANS, PANDAS is also known as basal ganglia encephalitis. For PANDAS to be diagnosed, a streptococcal infection must be identified, but for PANS, a trigger does not need to be identified. PANS is diagnosed using a diagnostic criteria, and it is a clinical diagnosis. There isn't one specific test that can diagnose PANS, PANDAS, but there is a test called the Cunningham panel that can be used to see whether a person likely has PANS or PANDAS. If you think yourself or a loved one has PANS or PANDAS, please see a specialist. The right care can prevent years or a lifetime of suffering.